Hemolytic Uremic Syndrome. It is the disorder causing the thrombocytopenia, cause acute renal impairment and hemolytic anemia. So description said thought to be associated with bacterial toxin, chemicals and viruses that causes acute kidney injury in the children. So the risk factor or agents, bacteria, chemicals or viruses, and they make a condition result from damage of the small blood vessels in the kidney, and this causes diarrhea, abdominal pain, vomiting and fever. Usually occurs primarily among the infant and small children between age of 6 months and 5 years. The clinical features include acquired hemolytic anemia, thrombocytopenia, kidney injuries, and central nervous system symptoms. So the pathology, the toxic produced by the organism, this is the organism. It is called E. coli. The particular number E. coli 870157. This is the bacteria identity number. So the E. coli produce the toxin. Toxin produced by E. coli causes the destruction of red blood cell and damage to the blood vessel. So when blood vessel damage in the kidney, we call the microangiopathy. Say microangiopathic hemolytic anemia. What are the meanings of microangiopathy? So microangiopathy, also known as microvascular disease, small vessel disease, or microvascular dysfunction. Microangiopathy is a disease of the microvessels, small blood vessels in microcirculation like the kidney, and they break down the red blood cell, and red blood cell go down and patient develop anemia, and this anemia is called hemolytic anemia. Also, patient chance to develop thrombocytopenia. Thrombocytopenia means it is a condition where abnormally low level of platelet are observed, and it causes the nosebleed, bleeding gum, blood in urine, or heavy menstrual period, or bruising because platelet go down, and all can lead to renal insufficiency. So renal insufficiency means the poor function of the kidney that may be due to the reduction in blood flow to the kidney caused by renal artery disease. Normally, the kidney regulate the blood flow and blood pressure, as well as regulate the blood chemistry and remove the waste product. But when kidney non-functioning, poor functioning, we call renal insufficiency. So all of this happened because of E. coli, right? And E. coli produce the toxic, it is called Shiga-like toxin, barotoxin. So who are under the risks? So if you inject ingestion of improperly prepared or raw food, because raw food can contain E. coli, or recent illness like gastroenteritis, they have a chance to attack by E. coli. So what are the basic presentation? Abdominal pain, bloody diarrhea, fever, seizure, and lethargy. So bruising and abnormal bleeding is most common. Patient present with a fever because infection, sometimes nausea and vomiting. Bloody diarrhea also common. So if you go for laboratory test, you can see anemia means decreased hemoglobin level, hematocrit level, and thrombocytopenia means decreased platelet count, and also increased creatinine, hematuria, and proteinuria developed. The treatment mainly supportive means IV fluid or dialysis, right? And also blood transfusion for anemia, plasmapheresis, and also, but no antibiotics. And so how can we prevent it? It is good to tell parents thoroughly cook all food can prevent it. Let me go back. So data collection stage. So triad of anemia, thrombocytopenia, renal failure. These three together, it is a characteristic feature of hemolytic uremic syndrome. Diagnose proteinuria, protein present in urine, hematuria, blood present in urine, presence of urinary cast. So usually it's supposed to absence, but if cast present, blood present, protein present in urine, there's something pathology. Blood urine nitrogen and serum creatinine level are elevated. Hemoglobin and hematocrit level are decreased. So let me read. What are the manifestation of hemolytic uremic syndrome? As I told you already, but there are few more. Vomiting, irritabilities, lethargy, pallor because of anemia. Oxygen is go down to the tissue, patient feel lethargy. Hemorrhagic manifestation like bruising, petechia, bloody diarrhea. Oliguria and anuria means absence of urine or very scanty amount of urine. Central nervous system involvement like seizure, stupor, and coma. So what are the intervention? Hemodialysis or peritoneal dialysis. So if kidney does not work or insufficient kidney, poor kidney function, renal impairment. So the indication is a hemodialysis. So there is two type of dialysis. One is called hemodialysis and another is called peritoneal dialysis. So dialysis also known as renal replacement therapy. Hemodialysis means a blood purifying treatment given when the kidney function is not optimum. Peritoneal dialysis, we use dialysis through the peritoneum, right? The strict monitoring for fluid balance is necessary. Fluid restriction may be prescribed if the child is anuric. Also, measures to prevent infection provide adequate nutrition like IV fluid. Other treatment may include medication to treat manifestation or administration of blood product to treat severe anemia. So supportive treatment is important. And blood transfusion if patient has anemia, plasmapheresis, or dialysis. So this is the very basic hemolytic uremic syndrome. Particularly we talk here pathophysiology, risk factor, diagnostic test, treatment, and some education.